Good morning, everyone. Welcome to our Facebook Live session of the Mariposa Community Health Center here in Nogales. My name is Pereira. I'm the Chief Medical Officer. And with me here today is Dr. Taylor Jenkins, one of our obstetrician gynecologists. Dr. Jenkins, welcome.
Thank you, Dr. P.
Thank you for spending time with us today, December 26, 2024. And this is part of our intent to work with our community and our partners to show what we do and educate the community on healthcare issues. And Mariposa is committed to do that. Before we begin, I want to thank Edgardo and Marco and the Mariposa family for supporting this session. And before we began a moment ago, I was talking to Dr. Jenkins about three areas that I thought would be important to review. The first one is the importance of early prenatal care, but also the time of conception is important. And there's some things that women can do to reduce the risk of problems during and after pregnancy. And one of the comments that I was going to have Dr. Jenkins make is about what are the kind of things that women can do to prepare for conception. We spoke about medications and things like that, but I'm going to let Dr. Jenkins review what can women do to prepare for conception and try to improve outcomes.
Yeah, thank you. So the biggest thing I can recommend is coming in to see an OBGYN for a preconception visit. So certainly, for women who have chronic health conditions, things like high blood pressure and diabetes, thyroid issues, it's really important to come in and make sure that the medications that you're taking are safe in pregnancy, that are safe at the time of conception. And even for women who are not on any medications or don't have known chronic problems, it's still a great idea to touch base with your doctor so that we can do routine analysis, make sure we're not missing any underlying conditions. I recommend everybody who's not actively preventing pregnancy take a prenatal vitamin, and in particular one that has folic acid that has been shown to help improve pregnancy outcomes, and it's a really easy measure to take. But those would be my big three: is get in to see an OBGYN, take your prenatal vitamin, and take a look through your medication list to make sure there's nothing that could potentially negatively impact a pregnancy.
And that is sometimes not discussed enough. In other words, if you want to become pregnant, go and see the doctor. What are kind of things that you might be at risk for, and things to do to reduce the risk? Sometimes we don't talk about that.
Yeah, we don't. And I frequently will have patients who tell me they're healthy, but also tell me they haven't seen a doctor in 10 years. So it's just a great opportunity for us to, touch base and get to know our patients so that we're preventing those outcomes where we can.
And perhaps during that visit, some issues may be discovered.
They may be, yeah.
We know women who may be overweight, may have a high A1C, maybe elevated blood pressure, greater than 140/90. And those are the kind of things that working with you and your team, you can manage to reduce the risk for the time of conception.
Absolutely. And sorry to interrupt, you make a great point just to that end, that there are other things we discuss in those visits about maintaining a healthy lifestyle. So even in the absence of disease, we do go over healthy diet and exercise and all the other things we do to support a healthy pregnancy.
Right. Smoking cessation is another one, and all of that. So again, a preconception visit would be a good thing. We don't talk about that a lot, but I'm glad we're talking about that today.
Yeah.
The second issue is the vaccines to protect mom and the baby. Certainly we can think about the flu vaccine, very important. This is the influenza season, and we know that the most important preventive measure in influenza is the vaccine. So we do recommend the influenza vaccine at the time of pregnancy.
We do, yeah, and outside of pregnancy as well, of course, but especially so during pregnancy when our immune system is naturally decreased and we're a little more vulnerable to things like the flu or COVID or other seasonal illnesses.
And going back to what you just mentioned, the influenza vaccine, we administer to patients 6 months of age and older, and particularly those who are at risk with chronic conditions. And something about influenza, it can be a very serious illness.
It can.
Sometimes we think that a slight cough of runny nose is the flu. That's not true influenza. True influenza can be very significant. It can be manifested by abrupt onset of high fever, chills, cough, profound muscle aches, and sore throat. We do have a test in the office that we can diagnose, and if diagnosed early, we can treat it with oseltamivir. Yes. Of course, there are certain conditions in which it doesn't matter when you diagnose it, you still treat it. And so that's important to remember.
And to that point, in pregnancy, because of how serious flu can be, if you have some of those symptoms that you mentioned, we often will bring you in, we'll test right away. We have the benefit of having the same day test, but in the absence of that, we often will just treat for the flu if we're concerned that that's what it is, because it can be very serious.
At any time.
Yeah.
Possibility.
Yeah.
The other vaccine that we just talk about quite a bit is that of Tdap or pertussis. A recent article showed that there were about 32,000 cases this year so far. We've seen some in the community. That's whooping cough. And the vaccine is recommended during pregnancy. Can you discuss why it's recommended at every pregnancy and the protection that it offers?
Yeah, so for the general population, that's one that we only do every 10 years. For women who are pregnant, that's something we do every pregnancy, specifically so that they're able to build up antibodies for the whooping cough to help protect babies, especially in those first 2 months of life until they're able to get vaccinated themselves. We usually will vaccinate between 27 and 36 weeks of pregnancy, with kind of 27, 28 being our most ideal, to give your body enough time to build those antibodies and to help protect baby during that gestation.
And it's important to remember that pertussis tends to attack babies with more significant force. And so those are reason to help the baby through maternal antibodies.
Yeah.
That's important to remember.
I often will remind my patients as well, just during their pregnancy, that anyone who's going to be around baby in those first 2 months, whether it's partner, grandparents, that they should also be checking their vaccine records, because so often we forget about the partners and the other family who will be with baby.
Very good reminder, particularly those whose immunity has decreased over time. And we know that whooping cough is one of those. We do recommend that family members who be close to a newborn see the provider to make sure they're up to date with their Tdap vaccine.
Yeah.
The other vaccine, of course, is COVID-19. We have an updated COVID-19 vaccine available, Mariposa. Can you touch on that a little bit? Yeah,
so it is recommended in pregnancy. So if you haven't been vaccinated within the last year, I would recommend getting an updated COVID-19 booster. We do see, increases in adverse outcomes or, negative consequences from COVID during pregnancy. So that's something that, I think we've all luckily kind of moved past our acute issue with COVID, but it's still out there, an easy one to overlook, that everyone should still be getting.
Absolutely. And those are important vaccines during this respiratory season.
Yeah.
There's another vaccine that we're not going to talk about today, but is the pneumonia vaccine, recommended 19 years of age and older for women who have certain conditions, asthma and things like that. But the ones we emphasize, influenza, pertussis, and certainly COVID-19.
And actually, there is now the RSV vaccine as well available during pregnancy for women who are expected to deliver between September and January. So speaking of the respiratory season, that's another one that's on our minds.
So the idea is that women could go see the doctor and ask the doctor, what vaccines am I eligible for?
Yeah.
And that could help the doctor figure out what are the vaccines you need, and so on. So it's part of that partnership between patient and doctor to ask, what am I eligible for? And by protecting you protect your baby, you protect your family, right?
Yeah,
that's
absolutely.
The idea.
Absolutely.
And the final piece is moving to gynecologic procedures or offers at Mariposa. We'll see women who need gynecologic care, and some of them are procedure-based. In addition to the routine sort of pap smear or HPV testing. So can you summarize what are the sort of essential procedures that we offer that are really essential for many women?
Yeah, so there's a whole variety of office-based procedures that we do, primarily things like contraceptive procedures, so things like IUD insertions, Nexplanon, implant placement in the arm, certainly removal of those devices as well. Cervical cancer-related procedures, so in the event of an abnormal pap smear, we do colposcopies, which are biopsies potentially of the cervix to help diagnose cervical cancer, and then things like a LEEP or a conization procedure of the cervix to help remove precancerous lesions on the cervix. We do biopsies of the endometrium. We potentially do incision and drainage, or deal with any abscesses or lesions on the vulva or the external genitals. All of that is available in the clinic.
And those procedures do not require hospital stay. That can be done in the office with local anesthesia in most cases. Right?
Yes, exactly. And certainly, I think now more than ever, it's really important to talk about women's pain with those type of procedures, and we are, always looking at what's going to be best for any given, particular patient. And I would say most of our office-based procedures, there's local anesthesia or other things we do to help manage pain within office procedures. But for certain patients, we do need to do procedures in the hospital, and we have that ability too, luckily.
Right. We're not planning to discuss cervical cancer screening today, but I'm going to deviate a little bit because that's important. Things have changed quite a bit in the last 5 to 10 years on the frequency of testing and the onset of testing. The only comment I would make, and I'd like to hear what you have to say, is that those things have changed. The frequency is less. It's every year, every 3 years, depending on various factors. Clearly, if it's abnormal, the doctor may recommend a different strategy. For most women, there's a different frequency. Now, depending on the age, typically about 30, the doctor will do an HPV testing. So bottom line is, check with your primary care, with your doctor, and in some cases, a primary care provider to determine the frequency of your cervical cancer screening. We want to diagnose early because when we diagnose early, treatment is more effective. Would you like to add to that?
I think you said it perfectly. Definitely touch base with your doctor to see when you're due next. And, if transitioning between doctors or moving a lot, I would recommend just getting some copies of your most recent pap smears because it'll really help guide your doctor in deciding when the next one is due for you.
Yes, and I think working with your OBGYN is essential to determine the frequency and also when to stop having those tests done. I think more and more we get guidelines that say beyond this age, if the things apply, you don't have to have more testing. If you had a hysterectomy for benign disease. So I think all of that's a little complicated for today. But a recommendation is to see your OBGYN and really ask about pap smear, HPV testing, how often, when do I stop?
Yeah, absolutely.
So I think we covered today a few important things in terms of early prenatal care, conception precautions, vaccinations, and the GYN. And lastly, before we forget, we do have 24/7 coverage of OB.
Yes, we do, which is wonderful. So, we do full spectrum of prenatal care, and it's lovely that we have doctors on call at the hospital as well to help us out 24/7.
So we have specialists that are available to help us in the hospital 24/7, and we do that to minimize any issues that occur in the pregnancy, and you can be seen if the pregnant woman has any concerns about all of that. So that's something we don't want to forget. So. So with that, I think we're going to end our broadcast today. Again, this is Facebook Live from Mariposa Health Center in Nogales. I want to thank Dr. Jenkins for her presence today, and of course, Edgardo Mariposa for their support. And I will see you the next time. Thank you for your viewing and your support. Have a great end of December. Happy holidays. Good day.